with Ron Hood, Rick D'Amico, Alexis Del Chiaro, and Corey McCloskey.
Okay, if you could make yourself look better during your lunch hour, would you do it? A new procedure that can give you a fresh face and a new look, and it only takes a few minutes. How it all works. We may be, it's getting towards the end of summer, so...
Hallelujah!
Yeah, we're nearing the end of swimsuit season, but it's never too late for a little, nip tuck here and there.
A little bit here and there.
But does surgery scare you? How about a new lipo technique? Diane Ryan is taking a closer look at laser liposurgery coming up. Have you looked at yourself in the mirror lately and saw things you didn't see before, like an extra chin or a sagging jawline? If you don't want to undergo major surgery, there's a procedure you can do during your lunch hour. Diane Ryan shows us how you can do it.
Hey, good morning, everyone. I'm Diane Ryan here in Scottsdale with Dr. Todd Malan. And this you're looking at right here, this is the Smart Laser Machine. And the reason why it's smart is because it's a whole lot easier, I guess, for you and for the patient.
Much easier for the patient. Instead of using the traditional old-fashioned liposuction where we use a large cannula that can be very traumatic and cause a lot of pain and discomfort, we can now use a little tiny thin laser. And the laser will effectively melt the fat and also tighten the skin at the same time.
Now, how does it work? You put it under the skin?
Yes, a little small pinpoint incision under the skin. The laser then sits underneath the skin, melts the fat, and it'll also tighten the skin at the same time.
And I understand the downtime isn't too much.
It's really not. With regular liposuction, sometimes the patient can be out of work for weeks. With this procedure, you're out of work for maybe 12 to 24 hours, and there's very little pain, very little discomfort, minimal bruising, and you really see immediate results. You don't have to wait weeks and weeks to see the results that you would see with old-fashioned liposuction.
And this is actually the operating room where it happens, right. And you're under, like, not just a local anesthesia?
Just local anesthesia, a little numbing medication, and that's it. That's all that you need.
We're going to bring in one of your patients over here. Come on over here, Shauna Dumas. And you said you just had it done. In fact, we're looking at pictures of you having it done.
Yes.
And this was, what, a couple weeks ago?
This was, yes, a week and 3 days ago.
A week and 3 days ago. And what did it feel like when you were sitting there having it done?
When I was actually on the table, I felt nothing at all. Actually, Dr. Malan asked me, do you feel this? I felt nothing while I was on the table. Actually, I felt nothing till later on that day. It was small discomfort, and I was back to work the following Monday.
And you had it a little under your chin, a little...
Mm-hmm. Right here under my chin, right here, and here.
And what do you think of the results?
I love them.
It looks very good. It looks natural. It looks like you didn't have anything done.
Right, and this is, of course, a week and 3 days of,
Now, have you done lipo before, any other kind of liposuction?
2 weeks ago, I had my stomach done.
With the Smartlipo?
Smartlipo with Dr. Malan. Yeah, and I liked the results so well. I came back and had my chin done.
Oh, that's terrific. Well, you look great. Doctor, how much is this, and how many times do you have to do it?
It's very comparable to regular liposuction, and it is a one-time procedure. It's permanently effective at removing the fat and tightening the skin. It doesn't require multiple injections. It's one time, and that's it.
And the cost? I mean, ballpark figure?
With regular liposuction, the normal costs are anywhere between $2,000 and $3,000.
Okay, and it looks like it's a whole lot easier than the regular lipo.
Absolutely.
So would you use this on everybody, or is it a specific patient that you should have?
No, anyone who's desiring liposuction for small, unwanted areas of fat that they just cannot get rid of with diet and exercise, this is a perfect solution for them.
Okay, well, thank you so much for showing us how it works. And guys, you heard it sounds pretty easy, and apparently, according to Shauna, it was. So back to you.
All right. Thanks, Diane. You know what? Dr. Malan is the first doctor in Arizona to do this procedure. So he's the only one out there. It's new, and it looks and sounds like a lot less you have to go through than traditional liposuction.
Well, and it's fast, because that's so important. I mean, do you have time to really schedule in surgery?
And we all want things now,
Exactly. We sure do. Okay, Andrea.